Hello guys, now we shall be discussing a topic of laryngeal muscles. Okay, our topic of discussion would be regarding the laryngeal muscles. Now when it comes to the laryngeal muscles, I hope all of you know that there are two different groups of laryngeal muscles. So one is called as the extrinsic muscles, another one is called as the intrinsic muscles. Okay, what are your extrinsic muscles? We have already discussed this video previously. Extrinsic muscles are those muscles which are present above the hyoid bone and below the hyoid bone. They are called as your suprahyoid muscles and they are also called as your infrahyoid muscles. Infrahyoid muscles. Now when it comes to the intrinsic group, what are the different kinds of muscles we have got? So let us discuss all these muscles one by one. Okay, first of all, okay, let me write it down and then I will discuss this muscle. So first muscle is your cricothyroid muscle. Okay, I will show individually. Second important muscle is called as your thyroarytenoid muscle. Thyroarytenoid muscle, cricothyroid muscle, thyroarytenoid muscle. Next one you call it as a posterior cricoarytenoid muscle. Posterior cricoarytenoid muscle. Okay, just write it down. I will show you these muscles. After posterior, we have got lateral cricoarytenoid muscle. Okay, and the fifth important thing is your transverse and oblique arytenoids. Oblique arytenoids. So these are the muscles which you need to know regarding the intrinsic group. So first of all, let us look at these arytenoid muscles. All of you know this picture over here, right? So what is this particular picture, guys? So this is the picture of your what? This is the picture from the front. So only and again I am telling only and only if you have watched the laryngeal cartilages video, come back to this laryngeal muscles and watch. Directly don't watch this laryngeal muscles because you won't understand what is this animation over here. Okay. So what I am telling you is that just look at this animation here. See, this is the anterior side. So this is your thyroid cartilage, this one is your thyroid cartilage. Now I am going back. Now when I am going back here, when I am going back, you know these cartilages now. That is why I am telling you. First watch this cartilages video and then come back. So this is your thyroid. After the thyroid, this cartilage is your epiglottis, right? All of you know epiglottis. And down here a ring shaped cartilage is called as cricoid. Backside when you come and zooming inside, see here I can see three cartilages. So upper two are called as cuneiform, down here is called arytenoid and this one is called as corniculate. So these are the cartilages here. Now let us look at each and every muscle. The first muscle which you can see over here, right? So this is your thyroid cartilage, all of you know, and just beneath here this is your cricoid cartilage. So between thyroid and cricoid, this muscle whatever you see, this is called as cricothyroid muscle. So this muscle over here is called as your cricothyroid muscle. And what is the use of this cricothyroid muscle? I told you it is responsible to increase the pitch, right? Previous videos I told you pitch of your voice, right? And second important thing is that this muscle stretches and tenses the vocal ligaments. Stretches and tenses the vocal ligaments, right? It stretches and tenses your vocal ligaments. Next important muscle which we shall be discussing is your thyroarytenoid muscle. What is this thyroarytenoid muscle? Just look at this. This is your thyroarytenoid muscle, right? Where is your arytenoid cartilage? See this particular cartilage which you can see on both the sides is called as your arytenoid cartilage, right? So and what is this particular cartilage here? This is called as your thyroid cartilage. So from the arytenoid to the thyroid you see a muscle here. From the arytenoid to the thyroid you see this muscle. This is called as thyroarytenoid muscle. Okay, so this muscle over here is called as your thyroarytenoid muscle. What is the use of this thyroarytenoid is that it relaxes the vocal ligament. It relaxes the vocal ligament. Next important thing after thyroarytenoid is your posterior cricoarytenoid. Posterior cricoarytenoid. So where is your posterior cricoarytenoid? See, this is your posterior cricoarytenoid. Cricoarytenoid. What do you mean by crico and arytenoid? It all the way comes from the cricoid region. See, this is your cricoid region and this is your arytenoid region. You see, this is your arytenoid region. So from the cricoid region till the arytenoid region, this green color muscle is called as cricoarytenoid muscle. And what is the use of this particular muscle is, it is responsible for the abduction of vocal cords. Abduction of vocal folds. Abduction of your vocal folds or your vocal cords. Okay, the true vocal folds. Next important muscle. So these are the things over here. This is another simple picture from the back. Next important thing is your lateral cricoarytenoid. Lateral cricoarytenoid. So where is this lateral cricoarytenoid? Again, from the cricoid till the arytenoid. So this blue color muscle which you can see over here is called as your lateral cricoarytenoid. So lateral cricoarytenoid function is your adduction of vocal cords. Adduction of your vocal cords. Adduction of your vocal cords. Next important thing, you can look at these muscles. There are two muscles I told you. One is called as transverse arytenoid, another one is called as oblique arytenoid muscle. So these are the transverse arytenoids. So first we have got a transverse arytenoid like this, right? And next upon that we have got two muscles that are obliquely placed. So these are called as oblique arytenoids, right? So one is transverse arytenoid, another one is your oblique arytenoid. So let us try finding that same structures over here. Okay, let us try finding those same structures over here. So all of you know over here that this particular structure is your thyroid cartilage, right? Now within this thyroid cartilage there are different kinds of muscles. Let us see what are the different kinds of muscles which we have got over here, right? So from the back let us see these muscles over here, right? So first important muscle, let me select the muscles over here, muscles of the head and neck, muscles of the neck. Next right now we are discussing about the laryngeal muscles. The first muscle which we shall be discussing right now is your cricothyroid. So again I am removing it, just look from the front view, right? You see cricothyroid in the sense, this is your thyroid cartilage, this is your cricoid cartilage. Between the thyroid and cricoid cartilage, whatever muscle you should have, that is called cricothyroid, right? So now what we shall do is that we shall look at the muscles, right? So this particular cartilage which you can see over here is called as your thyroid cartilage, right? Now apart from this thyroid cartilage, let us see what are the different kinds of muscles in the neck region we have got. So the first important muscle in the intrinsic group which we have discussed was cricothyroid. Cricothyroid in the sense from the cricoid bone to the thyroid cartilage. Look at this muscle over here. Where is this cricothyroid? This is cricothyroid. You see, this is your thyroid cartilage and this is your cricoid bone. You see this? This is a muscle that is attached here to the thyroid with the cricoid. So this muscle over here is called as your cricothyroid muscle. After cricothyroid, we discussed another muscle that is called as thyroarytenoid. From the thyroid cartilage to the arytenoid. Where are the arytenoids? On the back. You see these bones, these triangular shaped bones are called as arytenoids. You know that. Now let us look at this muscle. You see this? So this is attached. You see this triangular shaped muscle inside? This one, right? You see this from where it is attached all the way from the thyroid in the front to the arytenoids on the back. So this muscle over here is called as thyroarytenoid muscle. Next we will discuss about posterior cricoarytenoid. Okay, let us see where is this. See, this is the one. Okay, posterior because it is on the posterior side. Crico, why? Because down here we have got, what is this, a ring like bone? This is called as your cricoid bone. So cricoid to this arytenoid, that is why you called as posterior cricoarytenoid. Next we discussed about lateral cricoarytenoid. Let us see where is this lateral cricoarytenoid muscle. Okay, so here this is lateral cricoarytenoid. You see, this is lateral. So what I will do is that I will remove this thyroid cartilage so that clearly you can see. So from the side view, you can look at the cartilage now. Okay, so this cartilage is your cricoid, this is your arytenoid, and this is your cricoarytenoid on the back side. So posterior cricoarytenoid. Lateral in the sense it should be here. So let us look at the lateral cricoarytenoid here. You see, this is the muscle, lateral cricoarytenoid muscle. And after that we discussed about the transverse arytenoids. Where are these transverse arytenoids? Just look at the transverse arytenoid. You see here? So between the two arytenoids, I am drawing a muscle here. You see, this muscle is called transverse arytenoid. Okay, so these are some of the arytenoid muscles, and like we can also discuss about, let me put the transverse arytenoid. This is transverse arytenoid. Let us look about the oblique arytenoid also. This is the oblique arytenoid. You see, so these are the muscles that are located on the posterior side. So this is all you need to know regarding the laryngeal muscles, guys. So thank you so much for watching my video. Goodbye.